Natalia, thank you so much, and how much an orthoptist has to offer. Our audience has recognised this and the questions have begun.
Great.
So let's get to them right now. Others who are feeling a little bit shy, please don't be. This is such a unique and rare opportunity to pick the brains of an orthoptist. So yeah, please contribute. Natalia, if you could stop your screen share now, and then that will give us a nice view of speaking. Lovely, thank you. Okay, so our first question. Where the clinical assessment suggests no vision possible, brackets retinal detachment, however, parental observation shows repeated responses to bright light, brackets light reaction but not tracking. Are there tests an orthoptist could employ to confirm this?
Yes, the testing would be fairly straightforward. I guess with retinal detachment, when you're looking at light perception, what you kind of want to do is essentially what I would do is essentially kind of a light, a visual field using light as the stimulus to figure out where that light perception is. And then also chat to the family to see what options there are that we can actually utilize that light perception for them for function. So I hope that answers your question, but it will be straightforward. It also depends on whether or not there's cognitive and the brain is involved with that too. So that's where my head's also going. So it might not necessarily just be purely vision, but it might also be related to the brain. And if there's neurological involvement there, then there might be light perception that's happening. And there might also be latency to be able to pick up that light perception to consider. I hope that makes sense.
Next question, Natalia. Is there any benefit in involving an orthoptist for a toddler who is completely blind and possible light sensitivity? So this one is related to the previous question. Or are orthoptists only relevant for children that have some vision?
I guess there wouldn't be harm in actually introducing the orthoptist into a discipline meeting, a therapy meeting to discuss what the goals are and see whether or not that light perception can be utilised in any way to help with daily routines, to help that child with daily routines, and it could potentially be used in some way for that child. It also depends on whether or not you as a parent feel that is going to be valuable for your child as well.
Natalia, it's Melanie. I have a question there. Do you sometimes find that maybe medical testing, particularly if it's a few years old, might differ from orthoptist assessment of vision, particularly if that assessment happens in a sort of familiar environments or when the child is sort of not stressed or is well supported?
Yeah, I do see there is very much a difference. I do see a difference in the medical outcomes versus a functional outcome. So when a child is, assessed in their own environment, they don't have to deal with the travel, the weight, the noise, being poked and prodded. and the anxiety levels being up, all of these factors actually influence visual function, and it also influences the way that that child is able to use their vision as well. So you do very much see variability, and a good way of rehab orthoptists are able to close that gap is after the assessment, after the functional vision assessment, you then write a letter back to the medical doctor saying, right, these are my findings, and this is a summary of my findings. And that's something that I commonly do, is to help them see that there's a different side of vision to this child when you present it, when you assess them in ideal testing conditions.
Thanks, Talia. There's a few more questions. So using the Lego blocks for acuity, do you have an equivalent scale like the Smarty scale that we could use when doing a functional vision assessment?
No, I wish I do, but I don't. The best way to measure, to get a quantitative measure, is to actually measure the size of the Lego block. And what you could do is compare that to the scale of a near letter. Again, it's not really that comparable because you're looking at a solid shape versus something that requires higher detail. But I normally would, for quantitative reasons, I'll measure the size of the smallest image that they will see, whether or not that is a fairy in a picture book or a Lego block.
Okay, moving on. Do people require a referral to see an orthoptist? And can parents utilise Medicare or other funding for visits?
No, you don't need a referral to see a vision rehabilitation orthoptist, and I'm pretty sure, but I'm not 100% sure, that you need a referral to see a private orthoptist that doesn't work in rehab. But what we will do is we will ask families if we can have access to medical records. And so that's either you got families supplying that, or signing consent for the orthoptist to then go and seek that information. And what was the other part of that? Oh, the funding.
Yep.
So unfortunately, we're not covered by Medicare. Except that there is a Medicare number for autism. But aside from that, with private orthoptists, we are covered where you can get part rebate if you've got private health insurance with extras, if you're an NDIS participant, and there was one more and my head's gone blank. I'm sorry, but there is funding options. Yes. Yeah.
And some orthoptists work in hospitals too?
Yes, some orthoptists work in hospitals. For those orthoptists, they would need a referral because they would be working with ophthalmologists.
Yeah. Really. We have another one related to slightly related to funding. So do you think there are many orthoptists working independently and funded through NDIS plans, especially for lighting assessments?
So that's a little bit tricky. So I'm not 100% sure how many private orthoptists that there are, but there is an increase in number. I think I think, but I could be wrong, there's around about 10 to 15 private orthoptists across Australia. And I think I think the majority of them are tapping into NDIS. In relation to lighting assessments, that's a bit tricky, and that's because of the way NDIS is set up for home modifications. So if you're looking at a lighting assessment to change the actual fittings in the house, then I would suggest you do it with an OT and an orthoptist together. And that's what I have done in the past, because the OT has to put in the home modifications assessment, and the orthoptist comes in with the understanding around lighting and the impacts around lighting and glare in relation to different eye conditions. I'm sorry, NDIS is just a little bit, that system's just a little bit challenging.
Ms. Haller, are there other organisations that you can find an orthoptist in? So if they're not in private practice, are there sort of more other?
Oh yeah.
Yeah.
So, so yes. So orthoptists, there's a lot of orthoptists work in non-for-profit organisations, and that's where the majority of rehabilitation orthoptists actually work. So Vision Australia have orthoptists, Guide Dogs Australia also have orthoptists, Visibility in WA have orthoptists, Senses, Next Sense in New South Wales have orthoptists. So yes, so if you look at a non-for-profit, like a low vision non-for-profit, they have orthoptists.
Yeah, and still we have a thank you for some of those answers. Let me read this one. Okay, are parents given appointments automatically on diagnosis, or do they have to rely on doing their own research?
That one's are you talking about, can you just clarify that question in relation to appointments for rehabilitation, or I'm just a little bit unclear.
Okay, we'll give them an opportunity to expand on that, and we'll go on to the next question and come back. Is there a significant difference in the activities performed by a hospital-based orthoptist versus a private orthoptist, and I'd say possibly a community-based orthoptist? That's my own addition there.
Yes.
Is there a place for both simultaneously, or would a hospital-based orthoptist be sufficient?
So the two assessments actually complement each other. So I would suggest having both, because the hospital-based orthoptist is specifically looking for the diagnosis and management of that condition, whereas the community-based or private rehabilitation orthoptist, we're doing similar tests but different testing, and we're extracting different information, and we're specifically looking for function and how to improve that function. So both of these appointments or both of these services complement each other. So it's not one or the other, it should actually be both.
Okay. We're coming up to the hour. We haven't had an expansion on that question about parents doing their own research for, sorry, Natalie.
So can I just answer that if I was to interpret that? Yeah. So I'm not 100% sure what the referral pathway is in hospitals. But what I would suggest is, if a parent does get a diagnosis of a condition, please get in contact with PVI Alliance Australia. So we kind of overarch across a number of different conditions, and so we'd be able to support you there. Otherwise, please get in contact with the organisation specific for your diagnosis, and they'd be able to support you through that process. So yeah, but unfortunately, there's a little bit of parent kind of investigation that happens.
Yeah, and I think until, I guess, the message is out there in a really mainstream way, I think, yeah, sometimes the path to an orthoptist is not a direct one, but hopefully that will change with time and education.
There's also people working on trying to change that pathway as well. So PVI Alliance Australia, we're trying to actively make a change. So parents, so it's just easier for parents because they're already dealing with so much when you get a diagnosis. So you just want to go somewhere and you just know that you've got support and help and someone to guide you through that process.
Great. And you've got some thank yous rolling in there, Natalia.
Thank you.
So we are going to wrap up there. What an interesting webinar this has been. Thank you so much for sharing your wisdom, experience and enthusiasm. It's a comfort and an inspiration to know you are working in this space, along with hopefully all the other orthoptists who dialed into the webinar. Thank you to our interpreters and captioner for your services to ensure this information has broader reach, and to our audience for your attention, interest and thoughtful questions. I ask you to complete the feedback survey via the link that will show on screen once you leave the webinar. It will only take a few minutes and your feedback is valuable. The webinar has been recorded and will be made available on the Deafblind Information Australia website in due course. I wish you good night and take care.
Thank you.